This is my impression of getting a mammogram. If you've ever had a mammogram, then you can relate. If you've never had a mammogram, then this is what you can expect. Let me put my hair up. I know the last time they suggested I put my hair up. I see that the last time you had a mammogram, it was about 2 years ago.
What type?
Yeah, looks like it was a 3D mammogram. Yep.
Yeah, I don't think I had a mammogram last year, but I couldn't remember if it was a 2D or 3D because I'm pretty sure I didn't want a 3D. I wanted the 2D.
Nope, wasn't a 2D. Looks like it was a 3D. So I was a little concerned about getting a 3D mammogram. I was a little concerned about the radiation. Okay, let me tell you, a 3D mammogram will give us better images than a 2D mammogram. There's nothing to worry about, okay? You're getting more radiation using your cell phone than getting a mammogram here today, okay? So go ahead and take off your glasses. You can put it in the chair. Okay. Yeah, put it in the chair. Okay, go ahead and stand in front of the machine right there. Yep, just like that. And if you could pull out one arm out of your jacket and just stand in front of the machine. You go ahead and put your arm up. Yeah, put your arm up, put your arm up. Face to the left. Look at the daffodils on the wall. Okay, you're a little too close to the machine. Move backwards and lift your neck. See the gum that you're chewing? Please try not to chew while I take the picture, okay? So you do exactly as I say. Let me have control.
Relax, Habiba. Try not to panic.
Imagine a rag doll. Let me help you move your arm.
This is a whole gymnastics class. Move up, move down, head up, turn left, turn right, deep breath.
What was that?
Oh, I was just saying how much this reminded me of gymnastics or aerobics.
Oh, yeah. Okay, you're going to feel a little bit of pressure for a few seconds and hold it. All right, be right back.
Okay, Habiba, it's not that bad. It's not that bad. Take a deep breath. It'll be over soon. Real life, though, my mammogram wasn't that bad. This is me in the changing room after the mammogram, looking pretty crusty. But yeah, really cute. Of course, they have wipes for you to clean your underarms before the mammogram. And I love that they gave me a little coupon here. Not that I can eat this cake, but I just thought it was a cute gesture. For getting the mammogram, you get a coupon for cake and also a pill box, which at this age, I could use one.
Getting a mammogram obviously is a very serious matter. Even though I'm laughing or joking about the process, it is a very serious matter. Thousands of women on a daily basis are diagnosed with breast cancer, and you don't want to be one of them. So anyway, make sure you get your breast cancer screening test. Mammograms are still the gold standard when it comes to screening for breast cancer. And I'm sure you're aware October was actually Breast Cancer Awareness Month. So even though we're in November, last month, October, was Breast Cancer Awareness Month. And it is often used to raise not only awareness about breast cancer, but to raise awareness about prevention and screening for breast cancer. So again, don't forget to get your breast cancer screening if you are eligible. And who is eligible? What age should you start getting a mammogram? Who should get a mammogram? What age should you get a mammogram? What are your risk factors for getting breast cancer? I'm sure if you don't already know, you want to know, right? It is recommended that every woman should have a breast cancer risk assessment by a healthcare provider by the age of 25, especially if you are African American and Ashkenazi Jewish woman. So you should have had a risk assessment for breast cancer by the age of 25. I did not say a mammogram. I said a risk assessment by a healthcare provider, okay? So at what age should you start having mammograms? Well, currently, as of 2024, when I'm recording this, you are eligible to have a mammogram by the age of 40, assuming you're of average risk. So assuming you don't have a family history of breast cancer, assuming you're a normal, healthy woman without anything, major in your background to warrant earlier screening, the average woman can have a mammogram or her first mammogram by the age of 40. Now, certain women have a higher risk for breast cancer, such as having a genetic mutation. Some women that carry certain genetic mutations will have a higher risk for breast cancer. Women who have a family history of breast cancer. Women who have had a period at a younger age than 12, or if you started your period super young. Menopause onset older than 55. So if you did not go through menopause until you were much older, so older than 55, that can give you an increased risk of breast cancer. Having dense breast tissue, but I want to elaborate on that a little bit because a lot of women have dense breast tissue and it is quite normal, but having dense breast tissue during the age when you are getting mammograms can make it a little bit more challenging for the mammogram to pick up breast cancer.
A few definitions of what it means to have dense breast tissue. It refers to the way the breast tissue looks on a mammogram. It's common and it doesn't mean there's something wrong. It includes milk glands, milk ducts, and supportive tissues. It may appear as a solid white area, making it harder to detect breast cancer. Having dense breast tissue increases the chance that breast cancer will not be found on the mammogram.
In other words, if you have dense breast tissue, there is a possibility that the mammogram can miss breast cancer, which would mean that you might need supplemental imaging to verify, depending on your family history and depending on what the radiologist sees, etc.
Here's a really great article from Memorial Sloan Kettering Cancer Center about dense breast tissue. I will try to link it in the description box. It's an easy read and it explains everything in more detail and also what these supplemental screening tests are available for those at risk or with dense breast tissue.
So just keep that in mind, that having dense breast tissue can be considered a risk factor for breast cancer. But dense breast tissue in itself is typically normal. Another risk factor is having a history of radiation to the chest before the age of 30. If for whatever reason you had to have radiation to your chest area, that can put you at a higher risk for breast cancer. Another risk factor for breast cancer is never being pregnant. So sometimes you will see the form will say, or paperwork by GYN will say nulliparous. In other words, you've never had a child or you've never been pregnant. That can increase your risk for breast cancer. Or even women who have gotten pregnant after the age of 35. So having children or being pregnant at an older age puts you at a higher risk for breast cancer. There are also lifestyle things that people do that increase their risk of breast cancer, such as smoking, also alcohol use or excessive amounts of alcohol. Hence, women are strongly advised to limit the amount of alcohol they drink because that can increase your chance of breast cancer. So smoking, alcohol, a very bad or poor diet, high in fatty foods, high in sugar, high in artificial foods, processed meats, including refined carbs, excessive amounts of fried foods. So all of these things like smoking, drinking, eating foods that are not good for us are lifestyle choices that we can modify, right? So it's our choice whether we want to do better or not. Can men get mammograms? Yes, men can get mammograms too. It's not necessarily typical, but men can get mammograms too because men do get breast cancer. So if your husband, your brother, your son has a lump in their breast, make sure they discuss that with their healthcare provider because if they're younger, typically it's something normal, especially if they just went through puberty or if they're a younger male. A lot of times that is just normal breast tissue, but if they're older, certainly it could be breast cancer or something else. Make sure they are seen and evaluated by their healthcare provider. By the way, in the past, I did an extensive video about screening tests we all need. So whether you're a male or female, screening test you need based on your age, based on your gender, and I will go ahead and link it in the description box below so that you can watch it if you've never watched it before. And also, I hope you have watched my last video about menopause. I did a part 1 which got over 200,000 views, so I imagine a lot of you watched it, but I also did a part 2 with treatment options. A lot of times when I make these medical related videos, they are for adults, not necessarily for children, and if they are for adults, I will usually say so, but occasionally YouTube will limit the views on some of those videos because I may have used a word like, you know, vagina, which is a normal body part and a scientific or medical word, right? But they will limit the views on that video because they believe that videos like that may not be appropriate for advertisement, right? No ads can go on certain videos, so they end up limiting those videos or limiting the views on those videos. So I'm encouraging you that when you see I make a medical related video, you know that it's going to be serious, you know it's going to be up to date, you know it's going to be beneficial. Please try to watch them and please try to leave a comment. That way other people can see it. Otherwise, YouTube might end up squashing it and a video that I've put in a lot of work into doesn't get seen by you. So anyway, I appreciate you if you're watching this. And also on a positive note, I want to see if I can put out videos almost daily. What? So, you know, we're heading into the holiday season. I've never done a Vlogmas before, and I don't know if I can. I don't know how people do it, but so I decided, let me see what it would feel like doing a daily video every day in November where there's less pressure. So let's see if I can at least, if not for the whole month of November, let's see if I can do it for at least 2 weeks. A daily video in November for the first 2 weeks. Let's see how that goes. It will go well if you watch it. It will go well if you watch it. So I'm encouraging you to please check out this channel every day for the first 2 weeks of November at least. See, I did well already. I have a video today, which you're watching. And I put a video, the last video that I put out was day before yesterday, so that's not too bad. But I started this plan today, and today is only November 1st. By the time you see the video, though, it will be November 2nd, right? So, yes, I'm gonna try to do a daily video here, and the videos might be a vlog, the videos might be a medical related video, the videos might be something food related, because as you know, I have many different interests and God has blessed me with talent. So sometimes I don't want to do cooking videos. Sometimes I don't want to do a medical related video. Sometimes I want to do a doll related video, or sometimes we go out or we travel. So let's see what we end up with. And also I'm going to try to include in between all of this a segment for Kenton. Kenton is going to be coming on here. So if you don't see me, you will see Kenton. If you don't see Kenton, you will see both of us every day at least for the next 2 weeks in November. If I can pull that off, then it means I could potentially do Vlogmas. Let's see. I'm challenging myself and I want you to hold me accountable, okay? Please. All right, people. Thank you for listening. Thank you for watching. Bye. See you tomorrow.